Okay, thank you everybody for coming. It's not a good wisdom, but I don't want to cancel the class because we have to teach. We're gonna offer a little earlier, 3 o'clock-ish, let you go home. Okay, I just said there's snow, and I have to drive all the way to Pittsburgh, so we'll let you off a little bit earlier. So we have 2 lectures, 2 slides, lecture slides talk about the human disease caused by bacteria. We'll continue today. Today we are to have a little bit of topic about the sexual transmitted disease. So this is a kind of thing for the education of undergraduates. That's for sure. There's no doubt about it. It is important. So we talk about STD, and you can see it's severe. In the worldwide, 300 million new cases every year. They are transferred obviously with sexual activity, but they also could transfer from non-sexual activity. So for example, people donate their blood. If the pipes are not sanitized and the previous person repeatedly used the tools and the previous person has HIV or have any sexual transmitted disease, that could be certainly transferred to another person. Okay. There is some survey results talk about the STD. So they talk about STD. 95% of the STD in the world is from male to female. So that's survey results show that. Okay. Sexual transmitted disease. There is no vaccine for that. So, until today, there is nothing said you get 1 shot, saying you can go nightclubs to do whatever you like. There's nothing happened yet, unfortunately. Third thing, there is no, we can say very significant active immune protection. So what this means, which means you got sexual transmitted disease one time, does not mean you're not going to get it again. You got a syphilis, does not mean you're not going to get syphilis again. Like said very rudely, you just do whatever you like. That's not true. The last thing, we also want to say, there are 80% of STD is asymptomatic. Which means you didn't see any of the symptoms. But the people carry on the passenger. Could be virus, could be the bacteria. Asymptomatic. Number 5, we talk about the STD, our science, medical science is developed. Lots of the treatments. But there is a big debate in the science area. Should be an education, which means prevention important versus treatment. So, in other words, is this going to be a social science issue versus medical science issue? So people think the more important for prevent or treating even sexual transmitted disease is education. But the other people think we develop a vaccine, develop a treatment is more important. That gives people freedom. So there's a debate about that. This is my essay question in my major microbiology students in my other class. So they ask for extra points close to the final exams, and usually in the final exam I have a 25 points essay writing for this question. Okay, it's a debate question. It's very, very important for them to do a little bit of self-education. So, you can say some killed easily, others difficult or impossible to kill, and more frequently, obviously, is a sexual activity person, and the age group is 15 to 30 years old. Looks terrible. What is this? Gonorrhea. Urethral discharge. Happened in penis. So we want to talk about several things. Is Neisseria gonorrhea is the first one we want to talk. Neisseria gonorrhea. And how you spell it? Gonorrhea. Okay, Neisseria gonorrhea. Since it's a Neisseria, so it's a similar bacteria genonym with another pathogen we just mentioned, is Neisseria meningitis. It's the same thing. Therefore, this is gram-negative, large shape, Coccobacillus, and we say fastidious bacteria. What means fastidious bacteria? Doesn't grow on macaque agar, does not grow on blood agar, and only grow on chocolate agar. That's called a fastidious bacteria. Okay. What's the morphology? Extremely important. Coffee bean shape. And grow on the agar plates, brownish pushable colony. This is the characteristics. And this is important. So, gonorrhea, what happened is, at a male patient, okay, once you have a urethral discharge, if you have a pus come out from your urine sample through penis, we're going to get a sample to do the gram stain, to do isolation of the bacteria. We talk about the colony morphology, talk about the cell morphology. Then we will determine it. If you see the coffee bean shape looks like that, possibly, most likely, surrounded by white blood cell, possibly meningitis. Possibly Neisseria gonorrhea. How about female? Female, usually it's vagina discharge with abdomen pain, abnormal bleeding during the period time. Okay, then what you do? We say we get a discharge from the vaginal tract and we do the gram stain. And I tell you one thing, if a female patient, this does not work. Why? Because the vaginal tract has lots of other normal bacteria, including gram-positive, gram-negative bacteria, eastern molds, and everything. So, this doesn't work. If it's a female patient, this directly streak plating onto chocolate agar. Streak plating. If you see a colony, a pushable colony, then bingo, Neisseria gonorrhea. Now what else they do? Of course, you can get a colony to do some genetics analysis. That is the other things. Clinically, what they do another test, is oxidase test. If it's oxidase test showing you blue to purple color on the test strip, it is positive. So, Neisseria gonorrhea has a very important characteristic. Oxidase test positive. Now, what is oxidase? This we need to go talk a little bit more. So we know NAD goes to NADH2, goes to FAD, then goes to FES, FMN, COQ, then go to cytochroma C, and then cytochroma A, A3, and finally goes to oxygen. That's electron transport chain. You learned it in your science classes. Once the electron transfer go to cytochroma C, some of the bacteria need the enzyme. This is called oxidase. So oxidase, honestly, completely we should say cytochroma C oxidase. But people think you're smart, so they took it out. That's oxidase test. It's a test strip. Touch the sample in the air, in the normal room temperature, exposed to the air. Within a minute, you see it's a blue-purple color. It is positive. But be very careful. Is the oxidase test you have to do within 1 minute. You cannot do more than 2 minutes. What happened? Because in the air there is oxygen. So if you're doing an extended period of time, everything will become positive, gives you false positive. Okay, so that's something I want to mention. Another thing I want to say, gonorrhea, it could be transferred to the newborn baby. It's a conjunctiveness of the newborn when you showed up. So if the newborn baby you see like that, that's not a skin infection from the eyes. From the conjunctiveness, it's very possible. It's coming from the pregnant woman, it's from the gonorrhea. So this is extremely important to note, and the gonorrhea could be go to the newborn. Okay? So what we should do? Well, symptoms in male, female, you see that. I will say, just to be very briefly to say the symptoms, is abnormal discharge going through urinary tract. It's a vagina tract or urine tract. It's abnormal discharge. Of course, you're going to accompany it with like a embodiment pain, like abnormal bleeding, and difficult to pee, all those type of symptoms. What we do, we can using fluorescence testing or pelvic information testing, all those things. We can do the quick testing. And be careful, this passaging is also very invasive. So it could be decimated infection to joints, heart, and throat, because it's a very invasive pathogen. So something I want to also say, some of the sexual transmitted disease is not stay in the lower part of the body. It's going to go everywhere. It could cause neurological symptoms. Okay, so this is for gonorrhea. Testing, oxidase test we just mentioned, the gram stain, DNA probe test. Now what's the treatments? Obviously you're using antibiotics. But look at it here, the whole paragraph which is talk about. The condom use, quick diagnostic treatment of infected in individuals and the public education. Look at this one, it's at the top. That's what I said. There's a debate about the education, more important or the treatment is important. Okay? And also, people keep using penicillin, so they cause a penicillin resistance happens during the gonorrhea treatments. But that's a global issue, and all kinds of disease. Once they can use antibiotics to do the treatment, it's always have an issue is antibiotic resistant, because that has been abused for a long time. Syphilis. Okay, the next one is syphilis. So first of all, we want to remind you the syphilis. We talk about very briefly in the exam 1, what is syphilis? They caused by a pathogen is Treponema pallidum. Okay, what is Treponema pallidum? Do you still remember? This is we call a special bacteria. What is a special bacteria? It is asexual filaments like this. It's soft, composed by protein. So, what's a special name for this? Spiral sheet. Since it's a spiral sheet, can we do gram stain? Of course not, because it's a protein, it's going to be melted during the heat fixing. So we need to rely on a tall, dark field microscope. That's what we talked about before. Now what's a dark field microscope? We can do a brief review. The light, is it a block here? So the light going through the specimen is perpendicular. So the background is dark, and the specimen which is showed up. Tryptophan palladium is one of that. It's called syphilis. Syphilis obviously is sexually transmitted, but don't forget, same as a gonorrhea, that could be acquired going through the urethra, which is called congenital syphilis from pregnant woman. Syphilis has multiple stages. The first stage, called chancre. It's a French word. What is chancre? There is a mild ulcer on the skin of penis. That's a chancre. This took about 1 week, 2 weeks, or 3 weeks, or about a month. It's a little itching, so people know that. That's the first stage. Second stage, where they go, is basically what happened. Whole body rash. We gave them a name called gummas. Gumma. It's a French name. Gumma. What is the problem here? Once they have the gumma, this is disappear. So somebody will say, I'm recovered. Obviously, you're using some like an ornament, like a skin treatment or something. Then 1 month later, a couple of weeks later, that ulcer is gone. So you say, oh, I'm recovered. I can still doing whatever I like. And they don't care about this rash. That could be like an allergy or something, you know. But that developed to the second stage is gumma. That's what the picture looks like. Third stage, tertiary stage, now, that will go skin, bone, and nervous system. It's a neurological symptoms could happen. And I want to tell you one thing, syphilis used to be is the #1 sexually transmitted disease in the Asian countries. Because there is no variable treatments for that before the antibiotics comes out. That happened in all the Asian countries a lot. There's a little bit culture and a story background about that, but I just want to tell you it's the longest history of the sexually transmitted disease. Why people developed antibiotics? Because at the beginning they want to find a treatment for syphilis. That's what the antibiotics started to develop. Sounds very interesting, but I tell you one thing, that's why syphilis is important. What we do, clinical history, microscopic exam, and serological typing. Now, what's the treatment and prevention? Of course, antibiotic treatments at early stage. We also want to say syphilis is one of the typical sexually transmitted disease, could be asymptomatic. They could be carrying on the bloodstream for the rest of your life. In the third stage, that could be 5 years, 10 years, 20 years, or 30 years, which means you can always carry on. If the people in sexual activity, they think themselves is good, it is not bothering them, they could become a resource of contaminants for the other people. So that's why the treatment, prevention, control public education is important. So that's for the syphilis. Okay, next one. We want to talk a little bit briefly about Lyme disease. We mentioned this one before. Lyme disease is also belonging to sparrow-sheets. It's a second example of a sparrow-sheets caused by a pathogen called Borrelia burgdorferi. It's also a sparrow-sheets, which means Borrelia burgdorferi can also using dark field microscope to do the diagnosis. Why it caused the name as burgdorferi? This is a research microbiologist, a professor at Montana State University in 1970s. Dr. Burgdorferi is the first person who discovered these sparrow-sheets. That's why we want to memorize him, give him a big credits. Borrelia, we named Borrelia burgdorferi. So the species name is named by a scientist. Borrelia burgdorferi simply causing Lyme disease. So what is Lyme disease? What's the Lyme comes from? This is back in 1960 or 1970s. A small county in Connecticut. This is a Lyme County in Connecticut, close to New Hampshire, Vermont, in the New England area. Back in 1970s. What happened is people do the diving, two people do the fishing. They find their arm will showing up target-like circulated rash. This is a typical symptoms for Borrelia burgdorferi called Lyme disease. It looks like a picture like that. Where this comes from? Because of the ticks. It's caused by isodex ticks. A bite from the ticks could cause Lyme disease if they contaminated with Borrelia burgdorferi. You can see the picture here. All the red is in New England area. This area, they do lots of deep marine fishing or diving or catch those seafoods. Remember marine lobster, Maine lobster, you like that? Connecticut right here. Deep, dark red area is a major infected places. Although this survey is about 1907 to 1996, it's about 30 years ago, but it's still typical there. Now, where they do? It's come from a 2-year program. This is looks like your nurse program, 2-year, like a master degree to develop it. It's very interesting. It's not all of a sudden it comes out. So you can see at the beginning, it's a larvae. So female ticks drop it. Then the larvae is taken by a mice. Okay, it's a parasite, it looks like. Then the mice will generate a fecal sample. Then the fecal sample could go to a leaf or those environmental products, and then a nymph at the spring semester, we can say that for them, like a spring season, a little bit of warm up, so the larvae become a nymph. Then the nymph take it and get a bite to a person. And the person will have a fecal sample. Okay, the fecal sample go to the environments, infected another mice. Then what happened finally? It could be infected with a deer. And the deer will create the infections to another ticks. Because at the same time, the nymph has already become a tick. It's growing up. So what are we going to do? You can do this guy, of course you cannot cure all the deer. So what do? Ideally, you can control rats, but it's impossible in the environment to do. So only thing what you can do, control the idle dex ticks. Now, it's difficult to do theoretically. So usually, in this New England area, if you are actively to do diving on aquatic activities, we say, the family doctor will recommend you to do half a year or annual physical exam for idle dex ticks and also the Lyme disease, because it's very tricky there. This is easier to get. Okay. So that's a Lyme disease we briefly mentioned. Now, how we do the diagnostic? Western blot, ELISA, all those quick testing, we say the serological testing, PCR testing we can do. Treatment, of course, it's caused by pathogen using antibiotics. But more important, tick control and avoiding ticks. But it's hard to do, especially in the ocean area. It's not very easy to do the control. Okay, so this is end up with the finish the human disease caused by a bacteria. Before I go further, I would love to give you some of the examples for you to do study at home. So let's say you're going to read through this, okay, gram-positive coccyl. You're going to read through this. You don't have to remember what is Rebecca Lansfield group. What is alpha hemolytic streptococcus, blah, 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 then go here. What are we going to pay much attention? Is those case study. Okay. So where are they? Right here. So let's do a very simple self-testing. Let's look at these two questions. A 2-year-old girl is admitted to hospital with massive tissue destruction along her right arm. The skin is a violet color and a large fluid-filled blister are present. The patient has a fever, a rapid heart rate, low blood pressure, seems confused. Her mother informed the physician that the children had been recovering from chicken pox, and for the past 2 days had frequently been scratching at chicken pox lesions on that area. So it's recovered from chicken pox. Once the area appeared to have become infected, the infection spread rapidly. A gram stain. This is always important because it tells you what type of the pathogen, what's the characteristics of what it is. A gram stain of exudate from the infected tissue reveals gram-positive coccyl in chance. Okay, what is that? If it's gram-positive coccyl in chance, what it tells you? It's streptococcus. Because streptococcus is gram-positive, coccyl and in chain shape. Okay, now let's do it. Obviously, this is gone. It's not staphylococcus. Enterococcus facilis is gone. It's not streptococcus, although originally it's belonging to streptococcus, but it's not anymore, so this is gone. Okay, what we left? Streptococcus agalactia, streptococcus pneumonia, streptococcus pyogenes. And we said very clearly in the class, streptococcus agalactia is group B strep, who is a risk group? A newborn baby will cause newborn baby meningitis. So this is gone. What is streptococcus pneumonia? Number one, community-acquired ammonia. There's no symptoms here for ammonia. Therefore, streptococcus pyogenes is the answer. Okay, now let's say we're not sure for 100% it's over here. Risk group, breaks in the skin, like cut, surgery wounds, or chickenpox blisters. Is that good? When you read the question, you get the answers, and you go back to the first page to check. That's the answer there. So you can mark it red. That is good for you to do the study by yourself. So that's a case study. We're going to do some in the exam, okay? That's a question. That is one of the questions. Okay. Let's look at the second one. An 80-year-old female is transferred from a nursing home to hospital because she has suspected ammonia. Okay, that's not difficult. She is experiencing chest pain, chills, fever, shortness of breath. What do we talk about? Chest pain, fever. She has a productively cough. Okay, coughing. A gram stain sputum reveals numerous white blood cells and numerous gram-positive diprococci. Upon receipt of the gram stain report, the physician treats the patient for ammonia caused by. We already talked. This is a typical symptoms for ammonia. And chest pain, productive cough, and the fever. And it's older people also. The gram stain, gram-positive diprococci. Obviously, this is community-acquired ammonia from a nursing home. So, Streptococcus pneumoniae is the pathogen caused this disease. So this is give you some of the examples how you're going to do the study. You read, you look at your notes, and then you answer the questions. Okay, we're going to have lots of questions. Not a lot, but a couple of 10 questions in the exam will be the case study. So these are the examples for you to do a practice. Now, obviously, it's open book, so you don't have to remember. But you read through this, it is important. So just I give you example, okay? So this is just my example. Now, let's go through here. We're going to move on to talk about the next topic. Antibiotics. So we have been talking about so far. What is the treatment for these infectious disease is using antibiotics. So here gives you some of the definition. What is a chemotherapeutic agents? It is synthetic chemicals administered to people or animal for treating disease. What is antibiotics? Then what is antimicrobials? Okay, so how you answer that? How you understand about these things? So what is antibiotics? Let's give you a very clear and easy definition. And everybody could be very clear. Antibiotics. This is basically a metabolic chemical from one microorganism used to kill or inhibit another microorganism. That is called antibiotics. So antibiotics originally, it is natural products. Right now, what you have, those amoxicillin, penicillin, amoxicillin, tetracycline, all those things, it's already been chemical modified. Original, it is a metabolism products from one microorganism to kill or inhibit another microorganism. This one microorganism most likely is yeast or molds, which means it is eukaryotes. For example, penicillium created penicillin. This another microorganism is bacteria. You always remember, antibiotics does not work for virus because the virus doesn't have their structure. They have their target places to attacking. Typically, virus doesn't have a cell wall. The virus structure and the bacteria are completely different. Another thing I want to mention, we haven't talked yet. Kill, which means cyto. That is kill bacteria. Inhibit is static. You always remember, inhibit, the bacteria is still there. Only they didn't grow to jump to the log phase time, which means they didn't grow dramatically, but they're still there. Okay, now, the chemotherapeutic agents, it just tells you synthetic chemicals. Antibiotics have their special name. So penicillium from mold penicillium, tetracycline from streptomyces. There is one exception. Sulfur amines. Sulfur amines, we just said very briefly, it is sulfur drug. Sulfur drug is originally manufactured. It is not naturally existing. That is the exception. However, we always think sulfur drug is still belonging to the category of antibiotics. But it is not naturally produced by microorganisms. It is manufactured. Now, what is antimicrobials? Naturally chemically synthesized. Okay? This is a little bit of history. What we just talked. Syphilis, is that right? Look at here. In 1912, Paul Ehrlich discovered cell vaccine for treatment of syphilis chemotherapy. So I tell you one thing, when people started to develop looking for treatment, antimicrobials, antibiotics, it is started for looking for treatment of syphilis because it's a severe sexually transmitted disease in the old time. This is everybody knows. Fleming discovered the first antibiotics, penicillin. Then, remember tuberculosis? We said that tuberculosis using acid fast staining technology because of waxy cell wall caused by mycolic acids. Burgee and Waxman discovered streptomycin in 1944. Then in 1947, chloromazepine is the first broad-stream antibiotics created. But this is one we don't use anymore because it's a severe side impacts, will destroy the bone marrow system, which means severely damage your immune system. Everybody knows in the last 70, 80 years, since 1950, antibiotics used for treating human disease dramatically, then cause a problem, which is antibiotic resistant issue. Okay, so just want to let you know the history. This is an example. On the agar plates, you have a streak plating of a bacteria, then you put a penicillin there, you see the bacteria get killed. How do you know? The transparent zone surrounded the penicillin. This is a penicillin. You see the transparent zone here, which means the bacteria get killed. Okay, we get some of the terminology we want to talk about. So selective toxicity. The ability of drug to kill or inhibit the pathogen will damage host as little as possible. So we always want the antibiotics is very effective to kill the target microorganism, but has a very side impacts for the human being. So I give you a very simple example. We know penicillin, but penicillin is not everybody can use. The best way to do is to do a skin test. So penicillin used to be is a muscle injection only. It's not like today you have amoxicillin, like a capsule, you just take it, get a prescription from the physician. No, in the older time, you have to do a skin test because there is about 30% of the people which is penicillin allergic. So you cannot do it. So that's a selective toxicity we talk about. Therapeutic dose, the drug level required for clinical treatment. Now, toxic dose, it's drug level at which drug becomes too toxic for the patient. Usually it means allergic. Therapeutic index is toxic dose to therapeutic dose. So here is the mess. Therapeutic dose, nomination, denomination, toxic dose. What we want? We want this toxic dose, so smaller the better, is that right? No, other way. We want this toxic dose, so larger the better. And we want the therapeutic dose, the smaller the better. We don't want to use too much concentration. So what this tells you, Mass, the therapeutic index should be the smaller the better. Is that right? It should be the smaller the smaller the better. Okay? Side effects, we mentioned about undesirable effects of drugs on the host cells. Okay, what means narrow spectrum drugs? That means only effective for gram-positive or gram-negative bacteria. What is broad spectrum drugs? Attacking many different pathogens. Basically, we say is effectively for both gram-positive and gram-negative bacteria. We just mentioned killing microorganisms. We say it's a cyto. Inhibit, static. Okay, this is a very important testing. We need to determine the therapeutic index. So we need to find a very important number. It's called the minimal inhibitory concentration. There are several ways to do. One of the methods, what we're going to do, is Kirby-Boer test. In my major class, we did this in the lab for the lab section. Kirby-Boer test, how we do it. Kirby-Boer test is you put commercialized antibiotics in these tubes, are very thin. Okay, this is the pressure. You put it there. You had agar. This agar is a very special agar. It's not neutron agar. It's Muller-Hilton agar. Muller-Hilton agar. It's special agar for doing antibiotic resistance. So you have the agar, then you're going to put the bacteria there. So we had a bacteria use cotton swab, back and forth. Now, how many bacteria we need added? We can't just randomly dump in bacteria there. There is a volume, there is a concentration we need to control. That is called 0.5 McFarland standard, which means you will add in approximately 10 to the power of 8 cells per ml concentration on here. Okay, then what you do? Press the button on the top, and the disc will release. And you will see a lot of them like this. And every disc will have two numbers. if I write P10, what this means, this P means penicillin, and this 10 is 10 microgram. Antibiotics has to be reached microgram, not milligram. Okay, now we add it there. What we do? We do an incubation. 35 degrees Celsius, 24 hours. Now what you are looking for? The transparent zone surrounded the circle. Then, using a ruler to measure the diameter. Now, how do you know it is good or not? You need to compare a table. The table usually established by National Antibiotic Association. So I give you an example. For penicillin, if I get 20 millimeter, then I compare to the table. The table have a different number. They have a number using R, indicate resistant. So using a S, indicate susceptible. They also using I, indication intermediate. It's a number has already been set up by the previous experiments. So, if you get 12, 14, and 18, if I get my sample is 20 ml, 20 millimeter, what this means? Which means penicillin at 10 micrograms for treating this bacteria is susceptible to penicillin. If I have another sample, let's say this guy, I only get 10. Then what this means? That is less than 12. So this passage